Good afternoon, everybody. Thank you so much for tuning in to our second COVID-19 briefing webinar. For those who joined us previously, we really set these up to have a touch point with our community clinicians and providers to provide relevant and timely COVID-19 updates. So trying to share details from what the provincial level partners are saying and what we're seeing, of course, locally on the ground here in York Region. So my name's Dr. Farine Karachiwala. I'm one of the public health physicians and associate medical officers of health for York Region, and very excited to have Dr. Rebecca Shalansky joining me today, who's one of our fantastic PGY3 public health and preventive medicine residents at U of T. And she will do bulk of presenting, and we can toggle back and forth. We really want this to be a chance to also answer questions that arise. So I'll go over that process in just a moment, and just a flag that if there is anything that we don't cover today, like we did last time, we'll send it out in an FAQ document through our Public Health Matters website, which I will talk about in a minute as well. And just before we get started, thank you so much to our communication partners who made this live stream possible, and the great team that put that together. So Brooke and Sarah and Emily, thank you so much. Next slide, please. So this meeting will be recorded. You can feel free to ask questions. We'll be monitoring it throughout. Like I said, if we don't get through everything, we can send out some answers in written format as well. You won't be able to see each other's questions, but we'll be able to see yours. So that's fine. And if there's anything that comes up after you want a recording or anything, there's an email address located on the screen there at heocliaison@york.ca. Next slide, please. So to actually ask a question, there's a little box there that says live event Q&A. You can click on that and you can type whatever. It's just a free text, so feel free to type in whatever thoughts, comments, questions, and like I said, we'll be monitoring that. You just type it in and press send. And I should mention that the webinar recordings are also available on the healthcare provider section of our website. Next slide, please. So this is how you access our website. It's york.ca/healthprofessionals. And there's a little tile there for COVID-19, which has a bunch of updates and where we'll post things. And to sign up for our Public Health Matters newsletter, which is where we'll send a copy of the slides and some FAQ documents for any questions we don't get to, just click on the e-newsletter and subscribe there, and then everything will come by email. Next slide, please. So just to get started and see who is around and present, we have just a few questions for people. So again, if you go to that live event Q&A box, you'll see a poll, a link to a poll. So if you could just click on that and answer just a couple of very quick questions for us, so we have a sense of where you're practicing in York Region, or I guess if you're out of Region 2, that's great. And just what type of a practitioner you are and whether you've been to our webinar last time or not. So we'll keep the poll up for just a few minutes to see what responses come in, but please do click on it and just give us a brief sense. And if you're having any trouble with it, you can also type some things into the live event Q&A. And I'll just give it a couple seconds. Okay, this is fantastic. Thank you for the responses. So we see pretty spread out across the region. Lots of folks from Markham and Vaughan, and get to know a lot of primary care practitioners, allied health, and if you're other, feel free to also type into the live event Q&A box if you want to share what sort of field you're coming from. That's great. And some folks who have been with us before and some new participants. Okay, thank you so much for responding to that. Great. So just to go over what we'll be talking about today, so we'll provide a brief epi update so people have a sense of the numbers. We're going to go over a couple of new pieces from the province in terms of testing guidelines and serology. I'll briefly mention a couple of key points from a seroprevalence study. People, that's been very interesting, and some other jurisdictions reproducing that. We will discuss a bit on school reopening, although full disclaimer, Ministry of Education guidance is still sort of coming through on a lot of those pieces. But we're going to give some principles, what we know so far, and what we can share. And then lastly, I'll just give a very brief overview because I know lots of people have questions about what's happening with the influenza planning and grade 7 catch up and things like that. So I will pass it over to my colleague who will speak to the numbers in York Region.
Thank you for the introduction, Dr. Karachiwala, and we can move to the next slide, please. And this is Rebecca Shalansky here, one of the public health and preventive medicine residents, and it's an honor to be presenting to the local public or healthcare providers in the region. So this is a graph of the line list of cases in York Region, starting all the way back in February 27th, when York Region had its first case, and there's some key dates highlighted in the epi curve. So looking at the overall trend in recent times, we can see things are trending downwards. And I wanted to highlight two important dates. So the first is circled, the first circle in red is phase 2, stage 2 for York Region. And then the second red circle is phase 2, stage 3. So it seems like not too long ago, but phase 2, stage 2 is actually almost 2 months ago, and stage 3 now is almost a month ago. And while there may have been some upticks right after the stage transitions, and it's not exactly clear, this could also be just variation in data. Generally, we are trending downwards, and that's great to see. And we thank you for all of your helpful and hard work in helping us get to these downward trends. Next slide, please. In terms of some more specific numbers, the 7-day average of daily new cases in York Region is 4. So over the past 7 days, there have been on average 4 new cases per day. The rate per 100,000 population over the past 7 days is 2 cases per 100,000. So every day there's about 2 cases per 100,000 people. The R0, which I know there's a lot of talk about the R0. So as of 5 o'clock last night, it was 1.12. We know a R0 above 1. We like to see it below 1, but we generally are in the 1 range. And just because we have so few cases, it fluctuates on a daily basis. And this 1.12 could be because of a recent party where many of the residents were from York Region at the party, but generally are in keeping with the same R0 as the province. So we're not concerned, and it's generally fluctuating around 1. In terms of percent positivity of COVID-19 tests, so of all the tests being conducted in York Region, about 0.4% come back positive. Next slide, please. So in terms of some new information that's come down the pipeline recently, next slide, please. We wanted to briefly touch on the COVID Alert app, and this is mainly because we hope that you'll encourage your patients to download the app, as it's most effective when there's more people using it. So it is available for download today. Some people there's some discussion about privacy concerns, and really there's been a very thorough job to ensure that privacy is protected, and there's lots of information available on the Government of Canada websites about that. But in general, you can counsel patients that it uses Bluetooth to exchange random codes with nearby phones, and there's no way to identify the person using the app. And so how it works is if someone with the app is exposed to someone else with the app who ends up testing positive for COVID, and they're within their space for more than 15 minutes and closer than 2 meters in distance for that amount of time, they will get a flag. And of note, when someone does test positive for COVID, they have the choice as to whether they want that information to be used in the app, so they can opt out as well at the time. And so, you might have questions about if a patient asks you, okay, I got this alert from the app, what should I do? So the app actually does come with public health advice in it, so it will give advice to the person receiving the notification. But in general, the person should get tested and then should self-isolate while waiting for results. And an interesting note for healthcare providers is especially if you're working, let's say, in a testing center, you may want to disable notifications while you're working, because if you're wearing a proper PPE and it's likely you will be within 2 meters of patients, you might get a lot of notifications that you probably don't want to be bugged with. So please do encourage your patients to get the app, and there's a link here if you want to read any more information about it. Next slide, please. The other piece we wanted to touch on was updated provincial testing guidance. So this was most recently updated on August 14th. And 2 of the key points that were highlighted were the testing of asymptomatic contacts. The philosophy around that has changed a bit. So we are now more considering testing this group, but the emphasis is more on the 14-day self-isolation period. So for sure, if someone has symptoms, they should be tested. But if they're asymptomatic, it's not necessarily, doesn't necessarily have to be done. And then some guidance around if someone has prolonged exposure to a contact, then they should, or to a case, then they should be tested right away. But if there was just one incident of exposure, then you want to wait at least 5 to 7 days. Otherwise, the test might be a false negative. And then the next piece is on serology testing, which we know is a hot topic. So there are very specific clinical indications for serology testing. So basically the only 2 clinical scenarios where we would, or where serology testing is recommended, is for children with multi-system inflammatory syndrome who do not have a PCR COVID-19 lab confirmation, or in people with severe illness who tested negative for PCR and where serology could be helpful with clinical management. So a point we really want to emphasize is that serology testing at this time is not used to determine immunity. The science isn't robust on this yet, and there's still a lot more to learn. Possibly there could be cross-reactivity with other coronaviruses that people have been exposed to in the past, and as well, we don't know how long the antibodies last and how much immunity they do provide. Also important to note that in order to order serology, you do need approval, and there's a specific Public Health Ontario form for that, which we have linked later in the presentation. Next slide, please. And you may be aware of this already, but just to differentiate, really highlight the difference between PCR testing and serology testing. So in terms of what question each test is answering, so PCR, which is the nasal and P swab, is do I currently have COVID-19? Whereas serology, the antibodies won't develop until usually 7 to 14 days after exposure. So it's have I had exposure to COVID-19? How do samples get collected? So the very comfortable nasopharyngeal swab is for the PCR, and then serology is a blood test. What's being detected? So with PCR, it's the actual bits of the virus that they're detecting, whereas in serology testing, they're testing antibodies to the COVID-19 antigen. So there is more room for cross-reactivity with the serology test. And then PCR is used for diagnostic purposes only, whereas serology is used very specifically in those clinical scenarios that we discussed on the last slide, and also can be used in research for serosurveillance. And Dr. Karachiwala will be speaking to that in the next part of the presentation.
Great, so next slide, please. And just to point out, I see some questions coming up on the chat box about, if there is a positive case in a classroom in a school setting. So we will be getting to that in the school section and have a slide on that specifically. Oh yes, and these are just some helpful references. Next slide, please. Okay, so I briefly wanted to touch on some of the seroprevalence studies that have been done by Public Health Ontario. This has been sort of reproduced in other jurisdictions and areas of the world and helps provide some interesting information when it comes to, very rough information, but information nonetheless, when it comes to how many people have been exposed or infected, since we know that testing for PCR is just one point in time. And, you know, through our case contact management and testing process, we may not have captured every single case in the community. Next slide, please. So really, Public Health Ontario used a database of samples they had collected already to test the blood for COVID-19 specific antibodies. Like Rebecca mentioned as well, we don't know for sure still, or the science is still to be determined as to whether you are fully protected and whether the presence of antibodies confers protection and for how long. But for the most part, it seems like the antibodies last at least several months, hopefully provide protection, but again, don't know. And you tend to develop them 7 to 14 days after infection. So I know there was a lot of talk at the start of the pandemic about, you know, projections or estimates that 40 to 70% of people may be infected asymptomatically. So this is sort of helpful to answer those questions. Next slide, please. So essentially what they found, and I'll just focus on the actual number, and like I said, this is consistent with other provincial studies that have been done in other places in Canada and also some federal studies. So overall, 1.1% was the estimate in terms of seroprevalence in these samples that they collected. And there was some variation by age and sex. And this has implications when we're thinking through even, you know, potential second waves and magnitude and things like that, because we obviously know that unlike what we thought might have been happening at the start of the pandemic, there's not as much or as many people that were infected as we thought using these sort of rough indicators. Next slide, please. So just some helpful information. You can see just by age group and sex as well how the seroprevalence differs. So not too surprisingly, there is a higher seroprevalence in the older age groups, and that makes sense because we know at our peak of the pandemic, the peak was really driven by institutional outbreaks and cases in long-term care homes and retirement homes in our older age groups, and they also made up a bulk of the deaths that we saw cumulatively since the crisis started. Next slide, please. The other thing that is notable is this has differed by region in Ontario. Again, not that surprising. A lot of the GTA areas having a higher proportion of cases. So Toronto and then ourselves, so York Region is located in the Central East region. And you can see that our sort of seroprevalence rates are higher than some other parts of Ontario. So not too surprising and what we would expect. Next slide, please. Okay, so I'm going to pass it over to Rebecca, who's going to chat about school reopening.
Thank you. So next slide, please. And we know that this is a topic of quite a bit of relevance for both you and your families, as well as the patients you serve and their families. So just briefly touching over the guidance that came out from the Ministry of Education on July 30th. In terms of the general structure, so it's a voluntary in-person attendance for all students. In elementary school, which is considered kindergarten to grade 8, it will be an in-person 5 days per week schedule with one cohort in each class for the full day. And in secondary school, which is grade 9 to 12, it will be in-person instruction for 50% of the days, 50% of the day, and a class cohort of around 15 students. Next slide, please. In terms of safety measures listed in the plan, so self-screening daily for staff and students for symptoms. For masking, teachers will be required to wear masks other than with medical exemptions, and medical masks and face shields will be provided to teachers. It will be mandatory, other than again for medical exemptions, for students in grade 4 to 12 to wear masks, and encouraged and for students in kindergarten to grade 3, sorry, that 4 should be a 3, to wear masks but not required, and masks will not be required during outdoor time. Distancing as much as possible will be encouraged. There will be enhanced cleaning and public health. There will be funding for public health nurses in schools, and we will touch on York's role with public health nurses as well. Next slide, please. So we wanted to highlight what York's role, or York Region Public Health's role, is when it comes to school reopening. Guidance is from the Ministry of Education, and the local public health doesn't play a large role in actually developing the guidance. Our role is to support school boards in implementing the guidance in as safe a way as possible. And this includes support with the school public health nurses. And from our understanding, the public health nurses will play more of a public health role than a clinical role, helping with contact tracing and case assessment, and less so with seeing individual students, although they may also play a smaller clinical role as well. Guiding in infection prevention and control measures, providing guidance on cohorting, screening, physical distancing, and mask wearing. And all of this is set on the foundation of long-term partnerships that York Region Public Health already has with schools. And some of the nurses who will be in the school board are already working on the COVID-19 response with York Region Public Health right now. Next slide, please. So we know that there's been a lot of questions about school case management. I'm going to review some general points, and then Dr. Karachiwala will go through some specific examples and may take the time to answer some of your questions that have come through the chat. So we do want to emphasize that we are still waiting for official guidance from the Ministry of Education on school case management, and so this is still in flux. But we, of course, York Region Public Health will be working closely with school boards to support and guide them in the case of a COVID-19 case in a student or teacher. In general, if a child has symptoms of COVID-19, they should get tested and should self-isolate. And York Region Public Health will be involved right away, conduct contact tracing, advise on testing, self-isolation, infection prevention and control, and safe return to school. We'll be involved in daily communication with students, parents, the school board, and the region. And the school will be monitored until there's no new cases of COVID-19 for 14 days. And I'm going to pass it over now for some more specific scenarios. Thanks.
Great, thank you, Rebecca. So I see lots of questions on the chat box, and we're getting this all the time for sure about what happens when there is a positive case identified in a school, whether the cohort will be sent home, and really what are the steps, and will it be declared an outbreak? So again, as Rebecca said, the guidance that's developed, it's informed by the Chief Medical Officer of Health and Public Health Ontario, and then the Ministry of Education sends it out. We're being told by our provincial partners that it should be coming out soon. My understanding is it might be in approval stages, so we're all, like us included, very anxiously awaiting that. And as soon as we get it, we will definitely make sure we send it out to all of our partners. Now, we don't know the exact specifics, but you know, using our general principles of contact management is typically what we do, right? So if it's helpful, so in our daycare and day camp guidance, we are defining one case to be an outbreak. I don't know if the guidance is going to say the same thing, But importantly, even if we're declaring an outbreak, it doesn't necessarily mean that the entire school or cohort would be sent home. So we would be doing a risk assessment, and lots of different factors play into that. So if you have a younger cohort of children who are maybe not the greatest at compliance with mask use, or younger kids, just, it's a lot more difficult for distancing, maybe larger class sizes, that'll influence whether a larger cohort or that entire cohort, let's say, goes home. The other big influencer is whether the case themselves was actually symptomatic while in the school setting. We do know that transmissibility is higher in symptomatic people, so it depends on if they were there at school the day before they had symptoms, or they were frankly ill, which hopefully would be screened out. But either way, it's possible that someone was frankly ill while in the school setting. Also depends if it's a staff person or not a staff person, whether they're wearing a medical mask or a face covering, because we know the medical mask helps with source control, but also protects the wearer, whereas that's not the case for face coverings. So all of those same things that we use in the community would be applied to a classroom setting. If there's a scenario where somebody was at school a day or two before symptoms developed, they might be an older kid, they might have, been distanced, not taken the bus, then our advice to a couple of people that they're in more close contact with is to self-isolate, and the rest would be very close self-monitoring, increased cleaning and disinfection, increased environmental cleaning, and monitor very closely with the help of our school nurses. So it really depends on the scenario. Generally speaking, and I don't imagine this will change, again, this is all speculation, but we'll see from the guidance document, but a close contact is still defined, and that hasn't changed really since the start of the pandemic, but a close contact is still unprotected, close, prolonged exposure for 10 to 15 minutes within that 2-meter period. So don't imagine that will change. Typically here we have been excluding close contacts when somebody is sick and getting tested. So household contacts and siblings may stay home. We don't know what the guidance is going to say on that, and there has been variability. So that part is definitely still under review. Maybe I'll just quickly take the time to answer the note question, which we knew was going to come up, or Rebecca knew was going to come up. So I know there's been lots of discussion on this. Public health doesn't have too much involvement because it's really an employer who requested on behalf of the employee and may require a medical note. I think the intention, and ideally we don't want the health system to be overburdened because of multiple requests for notes. So what we were told by the ministry when we were also asking them this question is that some professional organizations are looking into it a bit more and may have some more helpful guidance around these things. And they're waiting for the Ministry of Education to comment. But it may also be school dependent, because it really is the employer and whether their own OC health department is going to require a note or not. I think the health people are sort of on board with it not overwhelming the health system and having so many of these come forward. So I know some professional organizations are working on it. I'm just monitoring the box here. So the question is about what happens if parents refuse to test a child with symptom. Again, I don't have a definitive answer on that. I don't know what the guidance is going to say. What we've done in daycare and day camp settings is it depends on the symptoms, if any other things can explain it, what the clinical assessment is as well. And sometimes we would exclude for 14 days from the date of symptom onset. But it again depends on what's happening. Are there comorbid conditions? Is there some other alternative diagnosis to explain that? And we work closely with the clinical assessor as well to figure that piece out. And also it depends on who else is sick in the cohort, if that's a consideration as well. Okay, I'm going to pass it back, and I'll keep monitoring the questions, and there might be some few minutes at the end too where I can weigh in a bit further. Back to Rebecca.
Thank you. Okay, so next slide, please. So I actually have worked as a family doctor for the past year and continue to do walk-in clinic. So I'm aware of these questions and being put in these situations with families as well, deciding whether they should send their child to school. Also teachers deciding whether they want to teach in person or whether they're more comfortable teaching remotely. With regards to students, it is ultimately up to the parent and student. There are no notes that are required if the student and parent decide that they want to learn from home instead of in the classroom. Things to consider when discussing with families whether it's safe for a child to return to in-person school is, first of all, at the moment, we do consider it to be quite safe to return back to school. The community transmission is very low currently, but of course the risk is never zero, and transmission rates can change, and our guidance may change or will change along with how the community transmission is looking like. Children as well, although the science in this is fluctuating as well, but generally children, especially younger than 10, are thought to not transmit the disease as much, and also generally have very minor symptoms to COVID-19. The multi-system inflammatory syndrome is very rare. So of course, we do know that there are benefits to returning to school in person, including social, developmental, and mental benefits. But there are certain children that will be considered higher risk and may not benefit from being in person. So these would include medically vulnerable children and also children who live in households with medically vulnerable others, whether it be a grandparent or a parent or sibling. Unfortunately, there's no specific risk of high risk conditions that we can use to say, this person should go, this person shouldn't go. But if we go to the next slide, there are some points that you can use to discuss. So on the graph on the one side is from the New England Journal of Medicine, and it's not specific to kids, but the staff in my clinic have actually found it helpful, or the other physicians in my clinic. So basically it looks at on the top risk of death from SARS-CoV-2, and then on the vertical axis occupational risk of contracting SARS-CoV-2. And then we can see on the other side the US CDC high-risk conditions. So in general, children would be considered younger age without high-risk conditions, and if they do have a high-risk condition, then they'd be considered medium or high. And then the occupational risk would be medium, contact with people with uncertain coronavirus status. So they would still be in that quote-unquote green category. So it says instruct the patient to wear a mask outside the home, practice recommended hand hygiene, and use PPE as directed. And this isn't an official guidance, it's just something you can use to consider, and you can also apply it to other workplace settings and teachers as well. So just a conversation point. Next slide, please. So we do have some time at the end to talk about the COVID-19 vaccine and influenza planning, but I know there are also a lot of questions coming in through the chat. So I will pass it back over to Dr. Karachiwala, and I'll take a look at the chat questions as well.
Perfect, thank you so much. So I'm going to try to address some of these questions that have come through the chat box. So one is, should students download the COVID app? Yeah, I think it's a very good idea. I mean, the higher uptake we have for the app, the better it will be as a population health measure. So a good idea. And I know they continue to make modifications to the app so that it's much more accurate in terms of your actual period of communicability. So those upgrades, we are told, are coming as well. So yeah, please do recommend it. I know there's a question around, the whole thing around a face shield as opposed to a face covering, if a student's more easily able to wear that or for whatever other reason. So The things we've seen from the World Health Organization is that a face shield is not a replacement for a face mask or face covering, but they do say, it's better than nothing. So it could afford protection compared to nothing at all. But the standard is still an actual face covering. And then we do know with both face shields and face coverings, the proper handling of that is really important. So people not sort of risk of self-contamination, but washing their hands before they put it on and take it off, storing it in a clean place, not wearing it around their chin and neck, all of that kind of advice still applies. There's a question around how kids are tolerating the nasopharyngeal swab. So, I mean, it's mixed, as you can imagine. Not a comfortable swab. I think adults and kids alike, not great. But, we've used it in childcare and daycare settings and haven't heard of anything too outlandish. Our Public Health Ontario lab colleagues have been looking into whether an anterior nasal or just nasal swab or throat swab is better. I mean, it can be used as an alternative if it's a really, particularly squirmy kid, let's say, or just somebody who's really not tolerating it well, right? And there could be so many reasons for that. So it could be an alternative. It's not as sensitive, but they're getting more information on the comparability, and it remains an alternative. So more may be coming out about that and its use. And I think more and more they're finding it could be performed similar. So for those situations where it's like really intolerable. And then I know there's this question around, should provisions be made for teachers who may have high risk conditions, having them not work or work from home. So I think this is something we are typically, we don't really have much say, I guess, or involvement in that part of things, because it's sort of the relationship between the employer and the employee and what is required and what's been sorted out. We do recognize, obviously, that there are certain people that are higher risk, and hopefully those conversations are taking place and finding sort of safe alternatives for everybody, including sort of children and staff alike. There are several questions around, whether the temperature checks are going to happen. So I haven't seen that in the actual guidance, but I've seen as more self-screen and prior to arriving. I know there's been some look at temperature screens and their effectiveness, and it's sort of mixed. So as you probably all know too in your clinical practice, it may not be the most reliable thing if it's one of those external temperature checks, like not one that actually touches the body. So it could be all sorts of false readings and various things that can happen. So I haven't seen that in the guidance document, or at least the Ministry of Education one that they released. We'll see if there's anything different in the outbreak or case management document, but it doesn't seem like that's going to be sort of a widespread must-have, and there are issues with accuracy with that. Let's see, we may have a whole bunch of other ones.
Not too much more.
Not too much more, okay. Okay, yeah, so maybe I'll keep monitoring, but I'll give a couple of brief updates on what all is happening in terms of the realm of vaccine. So just to point out, we are holding these webinars about once a month, and our September one will be themed along the lines of immunization. So talking about what is new with the COVID vaccine, like where are things at around the world, as well as what our plan is for flu and grade 7 catch-up. But we are getting lots of questions, so I want to address the grade 7 and flu. Next slide, please. I realized I had some text here. Great, so we are waiting for more information from the Ministry of Health, but we likely are planning grade 7 catch-up because we know people have missed their doses, and we'll be sending info on that soon. For flu, again, a lot of this will be covered in our next webinar. We very much know that demand will be high from everything we're seeing in the Southern Hemisphere, which is not always the best indicator because flu is just very unpredictable. But we do know that they're seeing a more calm flu season, which is great. I mean, there's distancing measures in place, high uptake of vaccine. So that's all very reassuring. the higher our flu coverage rates are, the better things will be for our COVID-19 response. So we are trying to promote that as much as possible, and we will partner with organizations to provide this. So prior to this, public health was not that involved in actual administration compared to distribution. We will be more involved this year. We don't want it all, of course, to fall on providers, and we are being told that pharmacies will have, I mean, they've been having an ever increasing role as the years have gone on, but they definitely will this year as well. So all to say, more updates are coming in September, and once we have info about release and what's happening with grade 7, we're going to send that all out through our usual methods of fax and our ENS email alerts, which hopefully is how you got the invite for this webinar as well. So I'll leave it at that. And I'm going to do a quick scan of just to see if there's anything else I can answer, because we have a couple minutes. Okay, so yeah, so I'm just going to address that last question about there is a situation where somebody develops symptoms of COVID-19, they're tested within the first few days and the test is negative, but they remain symptomatic. So what's the advice for household contacts, and are they supposed to keep quarantining? So, I mean, typically we know that your viral load is the highest right before and immediately after you develop symptoms. So, I mean, it's a possibility that the sample collection is not adequate. I mean, there are possibilities of false negatives, so we don't see that too often. The general advice that we've seen is that you would keep the person in quarantine, and if you're really concerned, organizing a retest is probably a good idea. So have them retested, and you can always call us or consult for more questions. And usually a symptomatic person, if you're very suspicious, they've had a high-risk exposure, they remain very clinically compatible, and you think there might have been an issue with specimen collection, then yeah, the safest thing is to keep them self-isolated as well as their household contacts. But you can connect with us, but we would usually recommend retesting in that scenario. Okay, well, so I think we're just about at time. There might be a couple that we've missed, but we will scan through them thoroughly and compile some answers in written format. Please do sign up to our Public Health Matters newsletter. Next slide. Thank you. Oh, great, and next slide. So just some important links that you might want to bookmark. There is our own health professional page. Public Health Ontario has some really good resources. They also have some things that are evidence briefs and a scan on other jurisdictions and what's happened with school reopening, if you want to check that out, a lot of which we covered. And then the Ministry of Health's webpage, where you can always find the up-to-date testing guidance, case definition, and our own page links to that as well. Next slide. Okay, and we just have a couple of quick questions for folks. Next slide. Okay, so if you have any questions, feel free to call us, and there's some links there. Next slide. I think we have a couple of questions coming up. Okay, great. So if you could just type these into the actual live event Q&A, really helps us to focus to things that you want to hear. We usually send out the invite with a link to provide topics. So I think most of the topics we talked about today came from the audience. So if you could just, it'll really help us out if you could type on a scale of 1 to 10 how useful this was for you. So did you learn something new? Was there value add? And whether you would attend our next COVID-19 webinar. So that one you can just type a yes or a no. And then if there's anything further you'd like us to address in our September webinar, with the theme being immunization, but other questions you want answered. And again, we'll monitor all of this so we make sure we don't miss a question. And if you have any other thoughts, feedback, please feel free to email at this email address. Next slide, please, and we'll just keep that up. Okay, perfect, and just the last note to sign up to Public Health Matters. So as I said, feel free to type in the live event Q&A chat box for any feedback questions, which would be really helpful for all of us. And thank you so much for attending, and look out for more info. Thank you so much.
Thank
Have
you.
a great day.